It wasn't just my anxiety was off the charts. It was really because of menopause. It was just exacerbating condition that I've always lived with, depression and anxiety. I have to do something. I went ahead and made the appointment with you and started getting help, and you've changed my world completely.
How has this changed your perspective?
I feel like I have just a better handle on my life in general, and I'm also paying more attention to what my body's doing. I just feel more in control of my mind, my body than before. But it's just not the level that it was before I started doing hormone replacement therapy.
If we can manage those hormones a little bit just so you have a better coping mechanism, that's where we want you to be. We're going to change people's lives in ways that I can't, and this is going to be part of your legacy, and I'm just honored and grateful. This is Dr. Terri-Ann Samuels, and welcome to the Menopod. I'm joined here by the Heather York, who has been, I've been honored to be able to take care of. She's my patient, and pure joy coming into the office. And I really wanted you all to hear Heather's story, so thank you for being here.
Oh, thanks for having me. I've been excited to do this. Yes.
Because again, you know, it's up to you guys. You guys got to find yourself in these women, and they're representative of all of you. So Heather, tell me, what has your journey been? Now we're talking a little about perimenopause and menopause, and our focus today, you know, I asked you to choose the symptom that really was helped directly by treatment, and you chose depression and anxiety, which I was touched that you felt comfortable enough that we could address it and that you were willing to speak about it. So thank you again.
Oh, sure.
So tell me how you got here. Firstly, how'd you find me? And then what took you so long to get here?
Right. Well, yeah, it did take me forever to find you, but I actually was referred to another doctor years ago, and I went to this doctor, and I just didn't feel right about the options she gave me. There was something that just didn't mesh well with me, and so I was kind of turned off about it. Mm-hmm. And then people, you know, you also hear about women being scared to try hormone replacement therapy because they think they're going to get breast cancer and stuff like that. And then I signed up for 23andMe and found out I didn't have the BRCA genes. Mm-hmm. So I was like, okay, let me pursue it. And you know how when you talk in your phone, your phone's always listening around you. So all of a sudden I started,
annoying.
Yes, but it's how I found you, because all of a sudden I started getting all these things on Facebook about menopause. And one of them was an interview you did. I think it was KPRC, mm-hmm. maybe Channel 2, local news Channel 2, I think. And I said, that's who I'm going to go see, because she's talking about it and just really frank about it. So I looked you up, and then I was like, surely she's probably not taking any new patients, you know, whatever, but you were. And so that's how I got in here, and I have felt so comfortable, and I tell everybody about you actually. So yeah, because you just not a lot of information about menopause out there.
Yeah, we were talking about how much bad information there is.
It's a ton, and what your options are, and you know, it's just a lot of, it's overwhelming, to be honest. And a lot of the girls that I work with at work are younger. They're mm-hmm. in their 20s and 30s, but I'm like, this is my experience and this is what's happening. And just so you know, you don't have to suffer. When you get to this age, you know, the hot flashes and everything's exacerbated is what I learned for you. It wasn't just my anxiety was off the charts. It was really because of menopause. It was just exacerbating condition that I've always lived with, depression and anxiety, that I thought I was managing until I went into full-on menopause.
Right. So what was that tipping point, right? You have anxiety and depression. You've been diagnosed. You've been treated. Mm-hmm. You know, we're getting to that stage in life, and then something happens. What was that tipping point where you thought, I need help, now?
To be honest, we had a girl at work that, my sister used to work at the law firm that I work with, and there was a girl there that accused my sister of doing something that she didn't do, and it was just kind of a sideways move that she did, but it enraged me so bad that I had to go home. I had to excuse myself for the day, because I really wanted to confront her in a not so appropriate way. Mm-hmm. And so I was like, my levels of anxiety, depression, anger were just like maxed out that I couldn't believe it. And even my boss that I work with, she's also a friend of mine. She's an attorney, and she was like, I've never seen you this angry, and this upset and this, and it really scared me. And so I was like, gosh, I'm not trying to go to jail. So,
being put in jail by your own law firm. We'll lock this one up.
That's right. So I just like, I have to do something. So, I went ahead and made the appointment with you and, started getting help, and you've like changed my world completely.
Tell me in what way?
My anxiety is way down. My depression is way down. And since I started the magnesium that you just recently put me on, my sleep, I've noticed I'm sleeping a little better. I can tell the difference in my anxiety levels when I need, now that I'm starting to learn about when I need a new pellet, when it's becoming time to get the HRT, I notice my anxiety levels start to climb, or my depression starts to happen. And so I'm kind of, just listening to my body too. Like, you kind of recognize when it's time for me to get another pellet or, make an appointment with you. But yeah, it's a lot.
It's a lot.
It's a lot.
It's a lot. No, it's a lot. And it's a lot for you to use the A and the D word. It's to say anxiety, to say depression, because it happens to a lot of women, but they don't recognize that these things get exacerbated when your hormones are now completely out of whack. And it's not a choice. You didn't choose to go through menopause. It happens, and it happens in its own time, and you don't know when it's happening, but you recognize that you were just, the coping mechanisms were not working.
We're not there.
Somebody was going to die.
Yes, somebody was going down. That's what was happening.
No, that's awesome. So what do you think are, barriers to women with anxiety, depression? I mean, there are other things. I mean, there are other symptoms that you've had, but like, what do you think are the barriers in terms of them seeking help?
I really think a lot of women think they're going to get cancer from getting hormone replacement therapy. And I was just reading an article about it saying that there was some study about it and that it was misinterpreted. And so it reminds me of the whole, when everybody gets into vaccines and how that vaccine study was actually not even correct, but it spreads like wildfire and then everybody's scared, and I think that's what's happening nowadays, but there's tests you can do now to even get tested, to get your genes tested, to find, I don't remember what it's called, but you can get the test to find out if you have those, what is it, estrogen receptive gene or whatever it is. And I just think it's fear. It's fear of cancer or fear of, they just don't want to talk about it. Women just don't talk about it.
No.
And they just suffer in silence, kind of.
Yeah, it's true.
Except their family members suffer too, because they're so like, sad or anxious or angry, and nobody really understands what is actually causing it, or exacerbating it, I guess.
How has this changed your perspective? I think a lot of women feel, when they're going through, it's midlife, right? And looking at your life trajectory kind of going forward. It's called second chapter planning, right?
Right.
What does that look like now that you feel a bit more empowered? Now that you found coping mechanisms for a lot of these symptoms?
I feel like I have just a better handle on my life in general, and I'm also paying more attention to what my body's doing. Where before I was just in my misery of anxiety, depression, hot flashes, all the other weird symptoms you get, joint pain, that kind of thing. And just kind of wallowing in it, where now once I've kind of I've been lifted out of that, I have more of a positive outlook on certain things. I mean, don't get me wrong, I'm still a little wild child,
Edgy.
a little bit. But, and I do have a stressful job, but I think in the long run, it just helps me cope better, with things that may come my way. So, and I just feel more in control of my mind, my body than before.
And then things like hot flashes.
Yeah, I had those really bad, especially in perimenopause. And that's when I started like trying to read, and I found out there really wasn't a lot out there. And like, when you Google, you get all these different things, you don't know what's the truth, what's not the truth. And, I don't know. It can just be overwhelming trying to learn about menopause. You need to write a book. That's what you need to do.
Did you hear that? Okay. Done. Done. Okay.
Yes.
Any more assignments?
Yes. Yeah. Well, it's like menopause for dummies. You need to
And
do that. You need to do
I'm
that
right
one.
there with you.
That's
Listen,
right.
because listen, I was just as much of a dummy until I, really took an interest in it. And that's the thing, is that I think a lot of people feel that somebody's a physician and they're an MD, that they're going to know anything
They
about
don't.
this. You really have to do the work. And I have done the work, right? Like you
Yeah.
have to take the courses. You have to be curious enough. You have to listen, because it's these patients that it's y'all that are teaching me, right?
Yeah.
and allowing me to apply it, to think it's almost like restarting your career after 20 years, right? It's a whole new aspect of medicine, and it needs to be managed, and you need to be listened to.
It's true. And like, when I went to my regular OB-GYN, she, and I was asking her these questions, she gave me some information, but then she really just referred me out to someone else because she didn't really, that's not her specialty, and so.
That's a good doc, though.
Yeah. She definitely, and unfortunately she's left the state, and so I've lost her, but she really referred me, or I lost my train of thought. I'm sorry.
Okay.
She, had to send me to someone else. It's not something that she treated. And it's hard to find someone, I think, that specializes in that. At least I didn't know. I mean, like I found you on Facebook, and just because there was just an interview with you where you were talking about menopause. And so I kind of looked you up and like found your website and all of that stuff. But, a lot of women don't have that, or they don't ask questions, or they think just because she's my OB-GYN, she should know all that stuff, but there's a specialty in everything. It's like if you're if you're like me working for a law firm, if you're going through a divorce, you're not going to go to a real estate attorney for that. What I mean? You want a divorce lawyer, someone who specializes in that. And I think it's hard to find. It's just not advertised, and it needs to be out there more, so people can get the help, or women can get the help.
Absolutely.
Yeah.
And to address breast cancer, we already know that, we have very good solid data that the incidence of breast cancer decreases by about 22%. For women who are on estrogen, when they get breast cancer, their mortality decreases by 44%. So we are doing something right.
Right.
And we know that every symptom that we have gets exacerbated after. We've known that in medicine for as long as we've been practicing medicine. Mm-hmm. For women, cardiovascular is probably the most obvious. Like the heart attack rate definitively goes up at 51 statistically, right?
Right.
So it didn't happen overnight. It's really because the hormones are doing what they're doing. And I think it's just a matter of getting people to kind of understand that, getting to the right doc, and that there is actually help out there. You shouldn't have to suffer. The other interesting thing, again, about you, Heather, is that you had hot flashes when you came.
Yes.
Most women identify that as that's a symptom, right? Mm-hmm. Everything else is like whatever. Mm-hmm. So what the interesting thing about you is when I asked your trigger symptom, you went back to anxiety, depression. Like that was far more important to you than just like stopping some hot flashes.
I did want to stop the hot flashes because that's not fun. Let me get that straight, because hot flashes are not a joke. That's like someone lights a fire inside of you. It's not cool at all. Mm-hmm. I mean, you could be in a blizzard and have a hot flash and you're going to sweat.
Give me a hot flash story.
I know, it's horrible. It's horrible. But I did notice, because I have fought anxiety and depression my whole life, it runs in my family. I have a sister who's bipolar. Mm-hmm. It's just, that was something that frightened me, because depression can be really scary to go, because you can have really low lows, and then anxiety, if you're nervous all the time, or, worked up, get easily worked up all the time. Like, yeah. And I was like, am I about to like lose my mind? That's the way I really thought. Like, I just couldn't even control any of my emotions, frankly, not just anxiety, depression, but everything was just over the top, and I'm pretty much already over the top. So we don't need to be spilling over more.
Straight over the top.
Yes. So I'm not shy at all, and I do think that my sister and I, have always openly talked about anxiety, depression, because I think nowadays, if you don't talk about it, then you're not going to get better from it. Mm-hmm. So you can't hide behind all that stuff. So a lot of people still aren't there yet, I don't think, talking about those subjects, but it's not really anything to be ashamed of. It's part of life,
Absolutely.
And then there's things you can do about it.
Absolutely.
So, but yeah, menopause definitely exacerbated that, and that was a big concern for me.
And I really like you emphasizing that word exacerbate, because I definitely don't want to give the impression that if you're struggling with anxiety, depression, that you're going to walk away from your psychologist or psychiatrist and you're going to walk in here and get hormones and we're going to
No, you still have it.
You still have it. It's complicated. And it's multifaceted, and we need to work together. I need to
Right.
work with your psychiatrist to get you there. But understanding that exacerbation can occur, and if we can manage those hormones a little bit, just so you have a better coping mechanism, that's where we want you to be.
Yeah, it's just like giving you a hand up, right? Like, because if you already have anxiety, depression, you know how debilitating that can be. But then when it's exacerbated by menopause symptoms, or perimenopause symptoms, it's just you feel like your life is spinning out of control, which is really how I kind of felt. Is things were just getting worse and worse, mentally for me. That I was just like, man, what's gonna happen? Like, am I just gonna like burst into flames one day? It was just so awful. So I just really wanted to get a better handle on my mental health and get rid of those ugly hot flashes.
Hot flashes are not
Those are, well, I am a naturally like heat sensitive person. I mean, look how fair skinned I am. I'm like, I can wear SPF 45 and get sunburned in an hour. So I'm like heat sensitive.
The hot flash was burning you from the inside
I was
out.
like, I am like cooking in here. This can't be good.
I'm internally cooking.
And when you're in a meeting or something and all of a sudden you feel one come on, everybody's like, what's the matter? I'm like,
you don't feel sexy.
no.
You do not feel sexy.
And you look like you're nervous or something. Oh, imagine all the times I've like, I like to go to Mexico and I travel and you have a hot flash while you're waiting in there to go through customs. That's not a good look. That'll get you frisked and everything. It's like, why is she sweating?
Dogs coming around her.
That was real for me. Like, that was really my situation a couple of times.
Get rid of your hot flashes so you don't get frisked at the airport.
Yes.
That's awesome. You made my day. That's awesome.
True.
So I want to know, you're going to look back at Heather York 10 years ago and say to her, what advice are you going to give to her, knowing that this wave of menopause is coming? What are you going to say to her? What are you going to reassure her? Because in moments she's going to say, the younger Heather York is going to say, hold on a second, I feel like things are starting to go quiff. No one's talking to me about this. What are you going to say to her so that she feels empowered to go through this?
That's a hard one because it's so hard it is hard to deal with. But you just have to educate yourself and know your body. And if you can't find somebody that'll help you, like if you go to a doctor and you don't mesh with that person and you don't feel comfortable, then go find someone else. That's what I did. I mean, just, there's this whole stigma that you can't say no to a doctor. Like you have to do exactly what they say. I mean, except for that one prescription I didn't take, I do everything you say, but
again, it's individualized.
Yes.
I'm not going to force you.
I know. I'm a mess.
And Heather was, no, ma'am, I'm not taking. Okay, no problem.
I didn't realize what it was for, so I was like, I don't think so. But now I'll take it. But anyway, I know I'm a handful. But you have to like advocate for yourself. You really, and if someone isn't listening to you, then you got to find someone else. Just keep trying. That's all. Don't give up.
You find your body responses better?
Yes. I feel like a different person, honestly. I mean, I'm still, I still have my temper. I still have all those things that I've always had, but it's just not the level that it was before I started doing hormone replacement therapy. It's better for society. Yes.
It's better for the whole.
Yes, it is. Yes.
She's so much fun. Heather, you are too much fun.
I'm a
And
little crazy.
I will never let anyone take you away from me. Because I get to walk into my office and like see Heather's on the schedule and just be like, yippee, because we can get to mesh and jam.
My coworkers would be like, who is she talking about?
Exactly.
Because I'm like pretty serious at work. I'm always getting mad about something at work.
That's all right.
Yeah.
That's all right. You're damn good at what you do. And it's been a pleasure. And I'm super honored that you came out here to discuss this very sensitive topic. You are going to change people's lives in ways that I can't. This is going to be part of your legacy, and I'm just honored and grateful, and I'm so happy to have known you.
Thank you. You too.
So great.
Thank you. You've changed my life too, and I'm so excited that I got to come here and be part of this. And I always look forward to my appointments. You're the only doctor I like to come see.
And we have coffee and tea too.
And water.
And water.